Hello, this is Ruth Hansten, and I'm here to talk to you today about Section 8, Teaming and Communication. This is a very in-depth section, and there's a lot of chance now for asking for feedback and delivering feedback, so that now you've been through a whole lot of training, you've done a lot of problem solving, and at this point we'd like you to look at how well things are going and to really evaluate your own practice again. So in teaming and communication, we're beginning to look at a little bit more of those conflict resolution and feedback skills that are covered in depth in your clinical delegation skills book. So we'd like you to read section 9, in chapters 8 and 9 in clinical delegation skills. And we would like you to go online and review the silent treatment study or the silence kills study. The silence kills study was the first study, and the silent treatment study is the updated. So we give you the URLs for that. We'd like you to begin to do some more in-depth education about what is emotional intelligence and how do I develop that. We'd like you to read then chapters 10 also in the clinical delegation skills, and to begin to do some evaluation of the way you give initial direction and set up checkpoints or huddles throughout the shift and ask for feedback. We'd like you to also be sure that you're doing what we call the healing moments or focused patient interview, where you actually connect with the patient at eye level and talk about what their goals are. So that if you haven't already done that, this gives you an opportunity to develop that skill a little bit more deeply, and to practice some feedback, ask for feedback. So there are lots of worksheets in this particular section that are related to feedback. And if you happen to be in an area, if you're working night shift and it's difficult for you to get feedback from physicians, try to get the feedback the next morning or the next day, or just very, very quickly after a call in the middle of the night. Just say, hey, maybe the next morning when they come in, say, hey, how did that go last night? Did you get the information you need? But just so that you begin to get comfortable with asking for feedback, really put yourself out there to do that. So worksheet 13, emotional intelligence and conflict resolution. In the delegation skills chapters that we ask you to read, there's opportunity for you to look at issues from your family of origin related to conflict. We're not being psychologists here, but it does give you an opportunity to do some reflection on that and develop your own emotional intelligence. We also ask you to really look at how you react to conflict. Are you an avoider? Are you a person who is aggressive or assertive with it? Are you collaborative? So certainly find out about yourself. We ask you also to find out what the silence kills and the silent treatment study tells you about how frequently nurses and other healthcare professionals actually approach people that they feel are incompetent, or they see doing things that might even harm patients. And that is something that is very concerning. So we make sure that people know the impact of that avoidance of conflict. So we'll be asking you about that in our conference calls, finding out what did that silence kills and silence treatment study tell you. In worksheet 14, we talk about making a plan, an initial direction, and a plan for checkpoints or huddles to reconnect and debrief. If you are in a leadership or supervisory role, you can certainly adapt this, say, hey, when I'm giving some initial direction to the staff that I supervise, how am I doing with that? So it doesn't have to necessarily be a shift report or giving initial direction to assistant personnel. You can certainly use this tool in different ways to ask for feedback, because that's the main objective we're looking for. You may not end up with 4 signatures on that worksheet, but that's okay. Worksheet 15 is introductions and healing moments, and this is an opportunity to just review that this is the basis for finding out what patients and families' intended results are, short and long-term goals. So we'd like you to actually observe, if you can, other people doing their introductions If you're working with the Studer folks, you might be doing the AIDIT kind of training, so that they're doing those kinds of things as well. But to really look at how people are doing with using that kind of healing moment connection. Worksheet 16 is the feedback model. And you can use our feedback model. There are certainly some exercises in the Clinical Delegation Skills book that you can use to practice your feedback. And we ask you, practice it at home. Ask for feedback and give feedback to people at home. If your spouse doesn't take out the garbage and you want him to. You can give him feedback and use that model and see how it works for you. It's a good opportunity. We'd like you to also talk to other people, like a manager or a subordinate, a peer, and a family member, to really find out how well you give feedback and what you've learned. It's a scary thing to ask for feedback. We understand that, but the more you get used to asking and you just go, okay, I'm ready to hear this, then the more you can incorporate that and improve your practice. Worksheet 17, again, we look at handovers, and we know from what we see in Sentinel events that there's a fair number of those that are related to communication, so 60 to 80% depending on what you're looking at and in what areas you're looking at, and some of those, many of those have to do with handover times where there's loss of information. So we want you to look at those handoffs or handovers, what worked, what didn't work. We have a shift report handover guide just as a resource for you. A worksheet, by the way, just quickly, on the bottom of page 45, if you have concerns about HIPAA and patient privacy when you're doing shift report at the bedside, there's some information that you can read on that. Interdisciplinary team communication. We'd like you to actually ask members of the interdisciplinary team about how you're doing with communication with them. This offers them the opportunity then to do a two-way kind of conversation about how well you're receiving information and how well you're, how well they're receiving information and back and forth. So we've got comparison here also about with SBAR and the 4 Ps. So if you're using SBAR for your shift reports or other kinds of handovers or calls to physicians, situation, background, assessment, recommendations, what we ask you to do, we compare this to the 4 Ps, and we ask you also to really focus, if you're using SBAR, on patient and family outcomes, patient and family goals. Just insert that in your head when you're doing the SBAR so you make sure you remember that. So worksheet 18A is feedback with a physician on the telephone or on-site is the next one. And then worksheet 18C is the interdisciplinary team conference. Some of you may not be involved in interdisciplinary team conferences, but again, if you work night shift and you see respiratory therapists a lot because, or PTs a lot because of what kind of area you're working in, or MHPs or MHAs, please, ask them. Ask someone that's outside of your profession how you're communicating so that you can get some feedback that you can use. Okay, so that's section 8. This is a really rich section. It gives you an awful lot of opportunity to kind of step out there and develop your own emotional intelligence, develop your conflict resolution and feedback skills, and just take that next step. Ask for feedback about your communication, handoffs, and initial direction. So thank you for joining us today, and we'll soon be looking at section 9 and the end of the course.